This calls for chest pain for a 55-year-old male who's alone at his apartment. And in these simulations, we use a system. It's a fictitious system, but we dispatch a two-person EMT ambulance that can transport, of course, along with fire department first responders that are usually EMRs. The fire department, one of their members will be an incident commander. And for high acuity calls, like this chest pain, we also dispatch a transporting paramedic ambulance crew, and they're dispatched at the same time. Now, the EMT crew, ambulance crew, may elect to start transporting the patient and have the paramedics intercept them or meet them along the way, or they may wait at the scene. Just depends. But we'll use this sort of scenario and this sort of setup for all these case studies. In this little made-up world, we have a small community hospital in our town that's within 10 minutes of any of our calls. We call that Mayberry General. And then there's a large full-service hospital, trauma center, stroke center, STEMI center, burn center. That's about 45 minutes away by ground, and we kind of tongue-in-cheek call that Mount Pilot Hospital and Clinics. Our crews, both the EMTs and the paramedics, work off standing orders, but they can use online medical control if they want to from that local hospital ER physician. So to begin our initial assessment, we're going to try to rapidly check the main three body systems: the neurological system, respiratory system, cardiovascular system. We're going to check out the brain by checking level of consciousness, which, if our patient's alert and talking to us, is usually a very quick check. Then we're going to look at airway and breathing so that we can check out the lungs and the respiratory system. Again, if our patient's alert and talking to us, then for the most part, other than difficulty breathing, that tells us that we have an airway in most cases, and then we can assess breathing as we talk to the patient and look at the patient. And then we're going to assess the circulatory system and check out heart and blood pressure and vascular system. And one of the best ways to check that is to get a hand on radial pulse immediately. So as you watch, you'll see that we immediately check that radial pulse while we're talking to the patient. And so this whole heart, lung, and brain, or neuro, respiratory, and cardio system are all being checked at the same time. Hey, what's going on?
Having chest pain today.
Today? When did it start?
An hour ago.
Okay, what were you doing?
Just sitting and watching TV.
Alright, I'm going to check your pulse here real quick. Is it really fast?
Yeah.
Okay, so your pulse is going kind of fast. I think we're going to put you on some oxygen. So my partner here is going to put some oxygen in your nose. Okay, so I'm looking at your skin condition. Are you real sweaty?
Yeah.
Okay. So you can see how we did an airway and breathing check immediately by talking to him. He talked back to us. We knew that his airway was open. We were looking for the rate of his breathing. It wasn't abnormal. We were looking for extra effort of breathing. There wasn't any abnormal effort involved. And we looked to see that he was breathing at a reasonable depth, not too shallow or not overly deep. We listened. Did we hear any noisy airway or noisy breathing? Just with our ears. We didn't really hear anything. And if we had needed to verify depth or verify the equalness, the equality of his breathing, we would have felt if necessary, but we didn't need to. And then while we were doing that, we also had a radial pulse check immediately. And first of all, it was there so that we know he has a reasonable blood pressure. It might be quite high, but it's not way low, or he wouldn't even have a radial pulse. If he had not had that radial, we would have checked a carotid pulse, but he's talking to us. We checked to see if his heart rate was really fast, and in this simulation with this patient, I needed to ask him, is it fast or is it slow, based on the scenario that he had made up for me to assess, and he said it was really fast. And so then I also like to know if it's very regular or irregular. And then finally I asked him about his skin condition. Was he really sweaty? I'm looking at him. Is he really pale or is he flushed? Do I see any cyanosis or blue tinge to his lips? Is his skin temperature really hot or really cold? And so did we find anything wrong in the initial assessment? Yeah, we found out that his heart rate was fast, and that plus his complaint of chest pain led to an immediate provision of oxygen. In this case, nasal cannula at 4 liters is what we started with. An under-breather wouldn't have been wrong, but it would have just complicated talking to him. And I didn't assess that he was in critical condition right off the bat, and started mentally preparing for this is going to be a transport, at least by us, the EMT crew, and we're going to need to talk to paramedics as well. Hey, what's going on?
Having chest pain today.
Today? When did it start?
About an hour ago.
Okay, what were you doing?
Just sitting and watching TV.
Alright, I'm going to check your pulse here real quick. Is it really fast?
Yeah.
Okay, so your pulse is going kind of fast. I think we're going to put you on some oxygen. So my partner here is going to put some oxygen in your nose. Okay, so I'm looking at your skin condition. Are you real sweaty?
Yeah.
Okay. And so where's your pain?
It's in the center of my chest.
All right. What's it feel like?
Like a
Okay. So on a scale of 0 to 10, if 0 is no pain at all and 10 is like the worst pain you can think of, what would you say it is right now?
about a 7.
Okay. We're going to fire this up in your nose. Feels a little weird, but it's you get used to it right quick. And what kind of history do you have? You ever had? Let me turn it down to 2. What kind of history have you ever had a heart attack before, or had heart problems before?
No.
Any kind of problems? High blood pressure?
High blood pressure.
You got blood pressure.
That's airway.
So you don't have high blood pressure?
I do.
You do?
Yeah.
What is it usually?
Really?
Okay. Well, we're going to check it. So once you get ready to do that, and I'm going to listen to your lungs real quick. All right? I want you to take a deep breath in and out through your mouth. What? I'm going to reach under here. One more. Okay. Does it hurt when I push?
A little bit in the center.
Does it hurt to take a deep breath?
Yeah.
Okay. You hurt on your back anywhere?
Nope. That's your arm.
4%. Anything back here hurt?
No.
You haven't fallen or anything, have you?
No.
Been in a car wreck? Got beat up?
Nope.
No trauma of any kind?
No problem.
All right. While you're doing that, I'm going to push on your belly real quick. Doesn't hurt?
Nope.
Doesn't hurt? No, I'm just going to finish up here. Anything here?
Nope.
Here? Nothing? So now that we've established our initial assessment, we've found at least an elevated heart rate, a concern about a potential life threat, and so we've provided oxygen, and now it's time to move to our secondary survey, which is a focused history and physical and a first set of full vital signs. So we start getting the blood pressure. If we were with a paramedic level crew, we would add an EKG in at this point, and the paramedic units carry a monitor device that'll let us get a heart rate with an EKG. It'll measure respiratory rate, it'll measure pulse oximetry, and measure capnography, or the end-tidal CO2. So we would add that whole device in now. But since we're working in the EMT level ambulance, we don't have that device. So we'll go with a manual blood pressure, and we'll start asking some history and physical questions that are going to focus on people who have chest pain. So we're asking sample history questions related to his chest pain. We'll talk to him about OPQRST and try to get further detailed information about his pain. And then we're going to do that focused physical for chest pain, which includes seeing if there's pain when he breathes or when his chest wall moves, and asking those sorts of questions. So paramedics are coming in the ambulance, and I think that we probably ought to have them check you out, do a full EKG, and probably do some treatment and probably go to the hospital.
Okay.
So we'll figure out where they're at. Incident commander's going to figure out where they're at, and whether we're going to wait for them here or whether we're going to load you up and go meet them. So we'll kind of get that. And so what do we get on blood pressure? We've got 210 over 100.
210 over 100, yeah.
All right, so that's up a little bit, but you said that was up.
Yeah.
Okay. But you don't have any meds, you don't have any nitroglycerin or anything like that?
Take nitro.
You do take nitro. When did you take your last nitro?
10 minutes before you get here.
If they're not close, then we're going to load up. So we would need you guys to grab us the cards, please. And we'll load him up and get moving. So 10 minutes to go on your nitro. Okay, so our standing orders from the physician allows us to give you another squirt of your nitro. Do you have the spray or do you have a pill?
Pills.
Okay, so we can give you another pill because your pressure's plenty and you're still having pain. Okay, so what did you say your pain was?
Like a 7.
A 7? Okay. So we're going to go ahead and give you wherever your nitro is. So I'll give you, put your nitro in a little thing and let you take another nitro pill. And then as they come in, we're going to get you loaded up and get going. So I need to leave the cuff on him. We need to recheck his pressure multiple times because we're going to be given nitro here. We need to continue treatment for our patient while we prepare him for transport. Whether we're going to transport as the EMT ambulance or we're going to wait for the paramedics. We need to assume that this is cardiac pain because anything else would be less serious. So we're going to assume the worst for our patient. If it is cardiac pain, it could be from a clogged up artery, coronary artery, or a clotted off coronary artery, or one of his coronary arteries has clamped down, or some combination of those three. In any case, the oxygen supply to his heart muscle is decreased, or the oxygen demand to his heart muscle has increased, or maybe both. Maybe the supply has decreased some, but his demand has come up some. So our goal is going to be to increase the supply while we can decrease the demand. Oxygen provided to him via nasal cannula will increase the supply, and we do things to keep him calm and reassured and transport him smoothly. That helps with the O2 demand. Also, nitroglycerin can become an option, and for us as EMTs, if he has nitroglycerin prescribed for him and it has not expired and he's still having symptoms, cardiac chest pain symptoms, and his systolic blood pressure is greater than 100, then we're able to give him one of his own nitroglycerins in an attempt to increase the supply by dilating those coronary arteries some and decrease the demand by reducing the amount of blood flow coming back to his heart. Nitroglycerin is a vasodilator, which means that it will dilate the peripheral blood vessels, mostly the veins, and it will reduce the amount of blood coming back to his heart, called preload. So preload reduction equals workload reduction and less demand for that left ventricle to work, which means then it needs less oxygen. So, all right, so anything else going on other than your chest pain? Any other symptoms you're having?
No.
You feel short of breath, nauseated, lightheaded, dizzy? Okay. Are you allergic to anything?
No.
And then no meds, and then past history-wise, you said you had some high blood pressure, but no heart attacks.
Yeah.
Took your last nitro 10 minutes ago. When did you eat something last?
Early this morning.
Okay, so it's been quite a while.
Yeah.
Do you have any indigestion, any gas, any burp or anything? All right. So this needs to go away. And the head of the cot needs to sit up, please. All right,
Dry that out.
we're going to help you very carefully to stand up and move over. Are you pretty dizzy right now or not?
No.
Okay. Okay, here we go. Stand, pivot, and sit back down on there. Sorry, we got that kind of low for you. All right, I'm going to set this right there. Is that all right?
Yep, that's good.
Okay. Get you hooked up and get you going. Okay, so now whenever we interact with the medics, we're going to give a real quick report. And that report is 60-something-year-old male, an hour or so of chest pain, substernal, rates it a 7 out of 10. Took a nitro before we got here. We gave him a nitro. Pressure was 210 over 110. Then we recheck it after the nitro, whatever we got after we checked it. Lungs are clear, chest is not tender. History of high blood pressure, everything else on exams, normal. Okay, so whatever that took, 30 to 45 seconds of trying to summarize it for him. And that takes a while to get towards deep. So, in summary, we rapidly performed an initial assessment. We found some tachycardia. That plus chest pain caused us to be concerned that a life-threatening condition existed. We immediately provided O2 for that and began prep for transport, which is our response for a found life threat. As we were doing that prep for transport, we began secondary assessment. Partner obtained vital signs and performed a focused history and physical that was focused on chest pain. We continued this treatment while we packaged up the patient and got ready for us to transport. The IC worked out the logistics of whether we were going to do the actual transport or ALS was going to meet us. We allowed the IC to bring their crew members in to help with moving things and bringing in the cart and moving the patient and all those sorts of things. But the lead EMT stayed focused on the patient care. And as we found out, that additional treatment was possible. The patient did take nitroglycerin. His pressure was sufficient that we could give it. His nitroglycerin was not expired. It was prescribed for him. And his symptoms were persisting. So we gave him some nitroglycerin, which served to increase his myocardial oxygen supply and at the same time reduce the demand that his heart muscle had for oxygen.